It's advised by health professionals to get a general health check with your GP at least once a year. And if you want to make the most out of your time in the doctor's room, there are some specific questions that can help. Dr Tamara Hunter is here to talk with us this Friday afternoon. Hello, Dr Tamara. Thank you for being with us today.
Hi, Jerry. Thanks for having me.
Pleasure. Now tell us, why is it important that we get an annual checkup?
Well, here in Australia, we're really fortunate. We've got a really good healthcare system. And whether we live in urban areas or rural areas, most of us have access to a GP or healthcare services of some sort. Now, we all go along to a GP for those acute things, you know, the coughs, the colds, the sore holes. But it's actually really important to have a long-term relationship with our GP to make sure that we've got that relationship going on with them, such that if there's big long-term health issues, we've got that opportunity to be open and honest talking to our GP.
Absolutely. What should a yearly visit entail, though? What sort of things should we make sure our GP checks?
Well, we know there's some significant risk factors for those long-term health conditions, things like cardiovascular disease and cancer. So we want to be checking in where we're at with regards to those things. Things like tobacco, smoking, alcohol consumption, our blood pressure. Some of us need to have our cholesterol checked, our blood sugar checked, depending on our family history. We want to check in with our weight management, and we want to check in with our nutrition on a regular basis. So tapping in with our GP is really, really important to have those discussions around those risk factors.
What about questions that we ask ourselves? What are three things you think we should ask when we go to the GP?
Well, it really depends on what age group you're in. So if you've got a young child that you're taking along to the GP, we know there's a set schedule of visits that a child between newborn and 4 to 5 years of age should have. And we know that that goes hand in hand with the immunisation schedule. So parents should be asking things about growth, eating behaviours, growth and development, learning, any concerns that a parent might have about their children. Then you've got people in their 20s and 30s. A woman, for example, should be asking about regular pap smears, breast checks, sexually transmitted diseases, skin checks and so on. And as we get older, the screening gets more significant. So asking about things like, when should I be having a mammogram, bone mineral density checks, even something like a fecal occult blood test for the risks of bowel cancer. And we do actually recommend for blokes, they go and see their GP between the ages of 45 and 49 for a well man check.
Yeah, it's hard to get boys in there on any occasion,
Sure
isn't
is.
it? What can we do at home throughout the year ourselves when you're playing doctor at home? What do you need to keep an eye on?
Well, we know that lifestyle has such a big impact on good health. So checking in with yourself about what you're putting in your mouth, you know, are you doing regular physical activity? Are you getting enough sleep every night? How's your stress level? How's your mental health? All of those things. Checking on your skin, making sure there's no lumps or bumps that you haven't seen before. And if you are concerned, of course, get back to your GP and have that discussion.
Excellent advice. Thank you so much for joining us, Dr Tamara.
Pleasure.